Thanks everyone for logging in today. We are thrilled to be joined by everyone for today's webinar. Just to let you know who is behind the webinar today, I'm Meredith Yingles, our Director of Relationship Management. I've been with Prophecy and APS for over 7 years, and I'm looking forward to introducing you all to how our clients are currently using Prophecy's validated nursing assessments to impact nursing initiatives organization-wide. And you all are really in for a treat today, as I'm joined by a true expert on the impact validated tests can have on the overall success across the continuum of patient care. And that's my friend and colleague, Ann Hackman. I actually was introduced to Ann as she was a previous Prophecy client, and she served as the coordinator of nursing outcomes and professional development at the University of Missouri. And while she was there, she conducted a research study to quantify the benefits her staff was seeing with using Prophecy's assessment to customize orientation. So she brings that firsthand knowledge and experience to her current position with Prophecy and APS as our Senior Director of Performance Management and Insights. So she is going to be discussing a few measurable outcomes and correlation studies that she has assisted Prophecy clients with conducting during her time here with Prophecy. So welcome, Ann. So glad to have you on today's webinar.
Thanks, Meredith.
And so APS is a technology company that's dedicated to help clinicians reach their highest potential. We currently work in over 150 health systems in the United States, including Dignity, Ascension, Memorial Hermann, Kaiser Permanente, and that's just to name a few, to provide insight into their clinicians' strengths and weaknesses. And then based on the results that Prophecy provides, we help develop personalized onboarding, orientation, placement, and then from one of our other products, Gnosis, we also provide information on learning. So to help reach this mission, we have the hiring and onboarding solution, Prophecy, and then an education and risk reduction solution, Gnosis. We have a great team of people dedicated to supporting our clients and delivering that better patient care. So to get more to the specifics on Prophecy, Prophecy is a national leader in nursing assessment, and what that scale provides us is truly unique insights into the nursing performance that are really unavailable elsewhere in the market. And in addition to a large client base of hospitals, we have over 400 staffing agencies that utilize our services throughout the United States. Our assessments cover all the nursing specialties, are nearly with 100 clinical exams in over 40 areas of practice. So, Ann, I'd love to bring you in here from a former client's perspective and ask you to kind of speak to what made Prophecy stand out for your organization.
Well, that's my pleasure, Meredith. I'm really happy to be here and to share some personal experiences as well as some of our client experiences today. When we were looking for assessments that were comprehensive, there are clinical knowledge assessments available, which many of us have used in the nursing education field. There are behavioral assessments out there that many of the HR folks have used for a long time in selecting candidates. What makes Prophecy so unique is that it's a really holistic approach. It's not just one of those, it's actually three-dimensional. So it's designed for nurses by nurses. So it's based on firsthand knowledge of what it takes to be effective. The assessment's been validated by external experts, other nurses who around the country who confirm that we are measuring the right dimensions for nursing jobs, and that those who do well on our assessments are likely to do well on performance evaluations. In fact, we did a huge criterion validity study of over 800 nurses, and we compared their performance on the assessments to their actual performance review by a supervisor, and an astounding correlation of 0.67, which is way over the expected correlation in a study like that on performance behavior assessments. So there's a lot of validity behind the assessments, and then there's that holistic portion of looking at both clinical and behavioral and situational, which has to do with clinical judgment, as we all know, which is really important for nurses, for us to know, can you think on your feet and can you handle situations? We wanted something like clinical that talks about medication administration and report transitioning, but that situational portion is how are you handling, physician conflict, patients and families, what are the soft skills in terms of communication, and then in the behavioral session, it's, are you getting the right people with the right values and the right personality DNA that will fit your culture?
Great. Well, thanks for that explanation. And, and we find that most of the facilities and health systems we look at are really focusing in on one of these areas. And we wanted to pause just for a second for a quick poll question for all of our attendees on today, and just see if you all are currently using anything in your hiring process. This might be something that you're familiar with, but does your organization use assessments during hiring? Prophecy really makes it easy to look at all of the aspects that impact patient care. It really, in particular, that behavioral assessment looks at those personality attributes that are critical for that patient care, especially in the high-pressure environments like you're mentioning, Anne. And so using all three together is what makes this system so robust and effective. And so Prophecy, because it does look at all three of those critical areas, our scale and independent validation enable us to predict the impact of the product on the nurse's performance over time. So from this, we're able to create what we call the Prophecy 1 score in the most common nursing specialties. And that allows you to predict a nurse's likelihood of success in that specific role. So as I mentioned, it combines all three pieces, the clinical, situational, and the behavioral assessments, into one weighted percentage. And the whole idea behind this is really placing those nurses in the roles that are best suited for them. And it's currently available in areas like ICU, med-surg, emergency department, labor and delivery, and NICU. So in addition to the Prophecy 1 score with its predictive percentage, our assessments are used in the continuum across the life cycle of a nurse's career, which you see here on the screen. Sometimes people refer to this, or most commonly it's referred to as pre-hire and post-hire, but we've broken it down into three specific areas. First is identifying talent, so getting those best applicants in the door, and then fostering the relationships with those applicants, onboarding and orientation, and then developing them and engaging them. So Anne, I'll let you walk us through these areas in a bit more detail.
Sure. So one of the things that really impressed us about the identifying talent portion using the Prophecy assessments pre-hire was that, especially the behavioral assessment, I was so surprised to learn that a person can take a behavioral assessment only once, but the client or the hospital could plug in different clinical specialties to see which are most deemed appropriate for that person based on key personality attributes. And those attributes are things like stress tolerance, attention to detail, cognitive processing. We all know that it takes a different skill set and really a different personality to work in different clinical specialties. We found this particularly helpful in the nurse residency program, where you have graduate nurses coming in and they're not really sure who they want to be yet or where they want to work. And this helps you to help them identify what area they're most appropriate for to set them up for success. There's a lot of things in terms of the identifying talent pre-hire, and it can also be used immediately post-hire to really help guide their learning and be able to streamline that onboarding process, target their training to their individual needs, and to integrate learning by identifying all of those educational opportunities to fill in the gaps. It helps us to bring new hires and nurse residents up to speed a lot faster, which of course can result in a much higher satisfaction by the nurse as well as a cost savings for the hospital. And then the other thing that we really liked was that we could use it in the developing and engaging phase to help benchmark teams. I mean, we found it's so interesting the way that people adopt new processes. So we actually started out using this for the nurse residents, and when the managers started seeing the results that happened after the assessments, they were like, I want to have my whole team take this because I want to know how everybody in my whole department is performing and where can we teach them to improve. And so there's so much broader application of the Prophecy assessments for ongoing professional development as well. So the reports that you get from the Prophecy assessments have to do with behavioral, meaning their core DNA, as I mentioned, and their personality attributes. Also then their clinical skills in terms of a specific clinical specialty. So you can do a clinical knowledge assessment for med-surg, ICU, neuro ICU. There's all different types of assessments for clinical specialties. And what those do is they are broken down into then knowledge domains that are easy then to correlate to a learning plan. So for example, when it comes then to onboarding, you're going to be able to create experiences that really meet the individual needs of that particular nurse. Placing a nurse in the best fitting practice area really goes a long way in terms of retention. We all know that there's high turnover in graduate nurses in the first 6 to 12 months, so we really want to set them up for success. So placing them in their best fit area sets them up to feel successful and to do a good job. So we're able to measure those new hire competencies that predict their success, identify those high performers, and that in turn has translated over and over in our different clients to improved retention, especially with the graduate nurses.
You're right, Ann. We have seen that over and over in terms of the retention and really helping that for our current clients. That really is a great segue into our next poll question. So we're going to pause real quick for our second poll question, which is whether or not your organization is tracking turnover. Again, we'll show all of these results after our webinar is over and we're going into the Q&A portion.
Okay, well, this is a really impressive graph, and it's one that really tells the story quite well. Our clients are seeing dramatic reductions in turnover across the board. So my role with my team at Prophecy and APS is to do the analytics for studies like this, and we're showing over and over that clients are reducing nurse turnover by an average of 75%. As you can see here, it's been proven effective in reducing turnover in both large health systems and smaller rural urban locations. So this particular 6-hospital, 1,000-bed system went from 24% turnover to only 4.5% after implementing prophecy assessments within 2 years. And the same happened in a community hospital of 100 beds, from 14% to 3%. So it really is applicable across the board. And I think we've all seen the literature now that's pretty scary. It talks about how it costs upwards of $82,000 to $88,000 to replace a nurse, a single nurse, and one, because we invest so much in them when they first come on board in those first 1 or 2 years. So the money cost that's spent in training that new nurse and the cost to replace them is phenomenal. So if we can just save a couple of nurses per hospital, they're excited about that. But boy, reducing it by this much is pretty tremendous. Okay, so once you've identified your top performers and decided to hire them, then the focus shifts to how the prophecy assessment results can be used to target learning. Each of the clinical and situational assessments is broken down into specific knowledge domains to pinpoint the gaps and to help you customize their learning plan. So for example, if I had a nurse that scored very well in cardiovascular and psychosocial and trauma, but not so well on respiratory, for example, I might then tailor that orientation to spending some time with respiratory therapy. Or here, this example has to do with knowledge, signs, and symptoms of orthopedic injury. So I might really have them do a couple of days on the ortho unit to bring them up to par if this is a med-surg nurse. So it just helps you really focus in on those specific areas. Now, that sounds like a great idea from a nurse education perspective, but the amazing impact of that is that when we did this, we measured nurse satisfaction, and as a result, we got a much higher satisfaction by the nurse because they felt that they were being recognized as being individuals. They weren't just a cookie cutter, go through week 1, week 2, week 3 with everyone else, but that we valued that they came to us with specific experience and knowledge, and that if there were gaps, then we were going to customize things to specifically make them, come up to speed faster, and they really, really enjoyed that.
That's great, and especially since you're trying, all the literature, as you mentioned, there's a lot of literature out there about nurse turnover being on the rise, specifically with that first year, and it being 35 to 61%. That was the latest statistic that I saw. And my favorite part about the targeted learning piece is that our clients are telling us how effective and efficient this makes their jobs. So we just have a quote here about how the nurses who go through this process are appreciative of that personalization, and so are our clients. And I know you have a lot of detail on this piece. Would you mind sharing your firsthand experience while you were at your previous position?
I would be happy to. We conducted a study using prophecy assessments in our nurse residency program, and we were trying to figure out the answer to the question of, can time from employment to competent practice be accelerated? As most hospitals, we were, looking at the financial implication of all the resources directed towards nursing education. We also, at the same time, were experiencing a high number of graduate nurses as our pipeline for the workforce. And really, they were the sole pipeline. There's very few experienced nurses coming in, which meant that we really had to ramp up our nurse residency program quickly. And we had to do it in such a way that to be financially viable. So, we questioned, how could we do this and what way would help? We decided to utilize as a base the prophecy assessments so that we knew exactly where the gaps were. And there were differences. There are differences in nurses that came from an AD program versus a BSM program. Nurses who'd done a senior practicum with our hospital had a different level of knowledge than those who had not. So based on that, we developed a curriculum that incorporated targeted learning as well as clinical immersion, simulation, and then, of course, technology-based learning, such as you saw before, where you can guide them directly into using Lippincott, Mosby, other courses to guide them into just exactly what they needed. So we wanted to, compress their onboarding time, but we also didn't want to sacrifice education, knowledge, or their confidence or competence. Especially confidence for the GM. We didn't want them to feel like they were being slighted because we were, moving them through more quickly. So there were some pretty amazing results. First of all, we were able to, in the first 2 cohorts of graduate nurses, so within the first 9 months, we reduced the onboarding time for ICU by 2 weeks and by med-surg by 1 week. And by virtue of simply reducing that time, we saw a huge cost savings. However, again, we were worried that, oh my gosh, now they're going to feel like, they're being rushed and they're not going to be as happy. So we wanted to reevaluate, first of all, whether their clinical knowledge changed. So we used the prophecy assessments post-orientation. So we had a pre and post measurement, and we saw an improvement in clinical competency assessments from 75 to 84%. At the same time, we measured via the KC Think tool, which is a standardized graduate nurse confidence and competence assessment tool. We saw dramatic improvements in their KC Think scores compared with the curriculum we were using previously. And what they were saying is, you care about me. You did it for me. You understood me. They were happy with that. So not only did we reach our goal of improving onboarding time, but we also saw an improvement in nurse satisfaction as well as clinical competency.
And it's worth mentioning that that shortened orientation time translated to bottom line savings as well. And it was over $85,000 saved on staffing in just those first 9 months alone.
Our leadership loved that part, especially.
I'm sure they did.
Right, so as I mentioned earlier, once we started using prophecy for the nurse residents, and the department managers were getting these scorecards that they felt were just phenomenal. They're like, how else can I do this? They started getting really creative. And now that we're seeing that across the board with our clients, that they're seeing the value of prophecy assessments in many different ways. Some of the more common ones would be to take a look at using prophecy assessments for annual competency assessments, which is a requirement, by Joint Commission and other accrediting bodies that we look at clinical competency across the board on a regular basis. So in addition to the clinical specialty exams that we have, which are suitable for this purpose as well, but we also have assessments in pharmacology, dysrhythmia, dialysis, diabetes. There's several that are targeted as well that you could use for annual competency assessments. They also, across the board, can drive a learning needs assessment for each department. So if I'm a new manager or even an experienced manager and I have 45 nurses and I want to know how to build their continuing education program for the next year, I could easily have them all take a similar assessment and then look at those knowledge domains we talked about and customize a professional development plan for the next year. Other things that it does is that it really is helpful to have a ready source of data for people like Joint Commission, as well as for Magnet, our Pathway to Excellence. In fact, all of our assessments, we have linked to specific sources of evidence in the Magnet process. So those of you who are applying for Magnet, you know how important that is, that you have the right data and the right kinds of reports. Well, so it's really great is that we have already mapped that for you, and Prophecy offers a series of standardized reports that can be plugged into your Magnet application. Other ways that we use them are within the baseline behavioral assessment. There's a subset assessment result based on leadership. So right off the bat, you can identify those nurses who have the personality attributes to become your next shining star. You can see who might lead a team, a QI team, for example, or take on a special project. And then if they're ready, we have assessments per role. So if they're ready for a charge nurse, we actually have a charge nurse assessment that can be administered to identify the key knowledge and personality requirements of a charge nurse. The same with the preceptor role. We have an assessment for preceptors. We have an assessment for clinical nurse managers. So you can see that you can actually build a leadership succession plan using these assessments as the baseline for readiness and for developing the professional development plan to bring people up to par so that they're ready for that next challenge. In some of these assessments, we have used them pre and post. So for example, if you're offering a class for preceptors, for example, you may want all the nurses that are going to go into that role to take the preceptor assessment. Then, as an educator, you could use the knowledge domains to identify where to emphasize key points in the curriculum of that course. And then post-assessment or post-course, you can have them retake the assessment. Now what you have is you have evidence. You have quantifiable evidence of the impact of education. You also have evidence of readiness for the preceptor to take on a new orientee. So, we're really excited about all of these different ways that our assessments can be utilized even in the professional development phase. So part of my role at the university was as a Magnet program director. So I'm painfully familiar with, those of you who've had to do that, with the rigor of applying for Magnet. And ANCC is a fascinating program, and it's excellent for growing a great nursing organization. And their rigor is part of what makes them so successful. But there is a lot of data collection and reporting that goes around the applying for a Magnet. And so what we've done is we have tailored certain reports, analytics through Prophecy that you can plug directly into various sources of evidence. We have a map for you. We have a crosswalk that outlines which reports are source of evidence for Magnet application. So it makes it very easy for you to use it. It also helps you to save them some time and money, because that's all time that's taken by valuable healthcare people like yourselves that are, out there taking care of patients. It saves you some time in reporting. The other thing that I think is very unique about Prophecy and APS, and I'm so excited to be a part of them, we help you directly by consulting to you on what studies and research that you want to do. We will customize reports for you, and we will do some of the work in data analysis. Many of our clients have helped, we have helped them by looking at their internal data around retention, around HCAP scores, even in efforts to reduce adverse events and improve nurse satisfaction. And we conducted those correlation studies between, those goals that they have and how they utilize Prophecy assessment results to impact their goals. So I think that makes us kind of unique in that our analysts are there to support our clients in using their internal data and for studies, and not just to, here's our reports for you, but we'll really help you work on it in a common way.
Exactly, and really that's a perfect segue into sort of the results of that impact that we've seen from a particular client when they've onboarded Prophecy and then used it across the nursing continuum. do you want to talk about this particular result that you have seen as well?
Oh yes, I love this. This is a North Carolina-based health system. They have over 1,100 licensed beds and 2,500 nurses, over 6 hospitals. They implemented Prophecy pre-hire and in the full effect of it as of summer of 2013. And they did that because they wanted to improve the quality of hire and their nurse retention. Their turnover rate within the first 2 years prior to Prophecy was very high at 23.8%, and actually not that different from what we're hearing a lot of around the country. But that means that almost a quarter of their nursing staff was turning over every 2 years. So our course research demonstrates that there are some really negative implications of that high turnover. Nurse satisfaction, patient care experience, HCAHPS scores. It's really not a desirable state. So they knew something had to be done. They utilized our holistic assessment in their hiring process so that they could identify those most qualified candidates. Then they used the reports on each new hire to customize orientation, as we just talked about, and that increased new hire satisfaction from the beginning. And they started to gain some attention from nurse managers and physicians. And I have to say, we felt the same way. It's like people start saying, I don't know what you're doing, but it's really paying off. I can see a difference. And they felt the same way. Their physicians were saying they were pleasantly surprised at the caliber of new nurses entering their departments. So they further used the assessments with incumbent staff who were receiving lower performance ratings from their managers and peers, and when they were being considered for new positions, they were able to find a better job fit for them. So 2 years after implementation, their nurse retention scores were over 95%. So they have improved and they've stayed high to date.
So this particular impact on the bottom line is really being seen across health systems across the country. Whether they're large health systems or smaller, the savings that we're seeing are really significant, as you see here on the screen. Well, the key takeaways from today's webinar are, we hope that the questions that you may have been answered. With Prophecy, how can you better select and retain nursing talent? With Prophecy, you can place and onboard those candidates in the roles that are best suited to their skills, experience, and personalities. And then, as Anne really helped us walk through, is identifying those high performers so that you can develop the next generation of nursing leadership and then ultimately impact goals and bottom line system-wide. So at this time, I'd love to open up the webinar for any questions.
Thanks, Meredith, and thanks, Anne, for your insight. I wanted to share some of the results of the poll. So interesting to see people are reporting their turnover, near or above the average.
And our second poll question.
Yeah, who uses the assessment? So again, this is a little varied across the board as well. Clearly a need for Prophecy. I'd like to see that.
Okay.
Yeah, we do have a couple of questions, though. They may have been answered, but it'll be worth repeating the answers. Is there a way to use the assessments to measure improvement?
Yes, absolutely. There are a number of ways to measure improvement. You can, as I mentioned, do a pre-intervention of some sort, pre-intervention assessment. So whether the intervention is a nurse residency program in total, or if it's a specific onboarding, or if maybe it's an HCAHPS improvement, and so you do a baseline, you do an intervention, and then you do a post-evaluation. And we actually have some new analytic reports soon to be available that will measure that percent improvement for you. All you have to do is do the pre and post assessments. So, one of the ways is even to look at an adverse event that happens. We had a client actually that used this. They were having med errors and weren't sure exactly what the situation was. They had all the nurses across the board take the pharmacology exam. They identified a real serious issue with a lack of understanding around Coumadin and heparin algorithms, and so they were able to pinpoint that. They created a course around that and then waited several months to make sure that the knowledge stayed and remeasured and saw improvement. And of course, those are things everybody loves. Risk management loves that. Joint Commission loves that. Nursing education loves that.
Thanks, Anne.
Absolutely.
Another question that came in early on, I'm not sure we completely answered, is Prophecy only for RNs?
Well, I'll take that one as well. Being a nurse, I can both faithfully say no. It is for way more than nurses. However, nursing has been our focus because the company is, again, has been nurse-driven. The assessments are nurse-driven. However, there are many applications. If you look through our library, we have assessments for the clinical non-RN people, such as respiratory therapy, pharmacy techs, physical therapy. There are a number of different allied health professions that are there. And we also have assessments for CNAs, for example. So we have a full library that we'd be happy to show you about and to talk about that. We also have modules that relate to Joint Commission and the what do I want to say? The annual nursing or annual patient safety goals. There we go. So we have learning modules around those as well that help you meet the core requirements for Joint Commission.
Thanks, Ann. One more came in early on when we were talking about the holistic nature of the 3 assessments. How does a situational assessment work?
Well, that's a great question because we didn't get a chance to spend much time on that, did we? So situational assessments are video vignettes that they offer a specific situation, as you might guess, around a specific issue. So the broadest situational assessment we have focuses on interpersonal skills, those soft skills that are applicable across all clinical specialties. So for example, it would be managing an irate physician that confronts the nurse in front of the patient. How would you handle that situation? Or maybe there's a team member who's playing on the computer and not doing their vital signs the way they are meant to. So again, the situations that are appropriate and generic enough across all clinical specialties. And the nurse is asked to state what is the least effective approach as well as what is the best effective approach, which gains better insight into their clinical knowledge and understanding, their judgment factors. Beyond that, we also have situational assessments for key clinical specialties. So for med-surg, for L&D, and for the ICU, we also offer separate situational assessments, and those are more clinically driven. Those would be situations about like post-hemorrhage, where you may observe a patient and then you have to say, what would you do first? So again, using that clinical judgment after viewing a specific video vignette is how those work.
All right, great. Well, thank you so much. I personally want to say thank you to Ann. Thank you for sharing your knowledge and your experience with using Prophecy. And then also for everyone that attended today's call, thank you. We value your time, and I hope that all of the questions you had were answered. Have a great day.